Okay, hi, Paul Sakis, Good News Broadcast, Pause the World for Peace. We're going to talk about our dogs, meow, a little meow. We have a dog and a cat lover also, I hear, and a veterinarian, Dr. Courtney Pierce, medical lead for canine pain at Zoetis, if I'm saying that right. And we're going to talk about something that happens, I think, to people also, osteoarthritis, and I think I've seen some of those days. Your dog might be in pain. Subtle signs to watch for, and how to help. September's Pain Awareness Month. Unfortunately, pain is not a month thing. Pain is whenever you have pain. So, hi, how are you this
I'm
morning?
great, Paul. I hope you are.
Okay, so far so good. So this osteoarthritis is not a nice thing, and I guess some people don't think that their dogs are human. No, or we're dogs, one or the other. But how can we help our dogs, and how can we see that a dog is not? Is it walking? Is it what happens?
Yeah, well, Paul, let's start with what osteoarthritis is. I think a lot of pet owners don't understand that osteoarthritis can impact dogs. Osteoarthritis is the most common type of arthritis in dogs, and it happens when the joints cushions break down. It's very painful when that happens, and that can impact everyday movements, everyday activities. And while most pet owners think about osteoarthritis being a condition of older dogs, it can in fact start pretty early in life.
How do you, so we're looking at a dog now. A dog is wagging its tail and looks like quite a happy dog. Um, but happy dogs wagging their tail is not an indication that they're not in pain also, right?
That's a really good point. Our pets, our dogs wag their tails, I think, just in being happy to see us, which is what we love about them. So you raise a good point. The signs of osteoarthritis can be quite subtle, in fact. Many of us think our pets will cry out in pain or have an obvious limp. But with osteoarthritis, it can be, like I said, a lot more subtle than that. Sometimes it's just a dog that takes a little bit longer to, stand up after a nap, or maybe hesitates when they go up the stairs. We all have a dog we know that loves to hop in the car and go for a ride to the dog park. It might become challenging for a dog to do that if they're suffering from osteoarthritis pain. And that's why it's so important that if pet owners notice any of these subtle changes, they partner with their veterinarian to hopefully get a diagnosis and start therapy early in the course of disease.
So when I have, or I do have, or so many of my friends have arthritis, some sort, serious and unserious, but any of it is not. But we take I don't know, I took an X-ray, I took a CAT scan, I don't know. Take all those. How do you know? Is that what you do to a dog? You take. I don't have a dog, so do you take the dog to the vet, and the vet has does X-rays, or how do they know that there's arthritis in the body of a dog?
Yeah. Well, x-rays are certainly one way to diagnose osteoarthritis. Another key way that veterinarians pick up on osteoarthritis is by their physical examination of the dog. So actually putting our hands on the pet and feeling where it might hurt for them. Every pet is a little bit different, and every veterinarian has a little bit different approach, but it starts with the owner recognizing signs. And that's why it's so important to visit your veterinarian at least once a year for a good checkup for your dog.
The kind people that I'm sure have done a lot of research on this, Joannis, that they have some good medicine for a dog who might have this concern.
Yeah. Well, Paul, I am not only a veterinarian, but I'm a pet parent with a dog with osteoarthritis. My little dog is named Ernie, and he's had signs of OA pain since he was about 4 years of age. But fortunately, we were able to intervene early with the medication that we make at Zoetis called Librela. Librela is the first and only injectable medication for the control of osteoarthritis pain in dogs. That injection is given once a month in the veterinarian's office. And for my dog, Ernie, it has made a huge difference. His quality of life has improved, and he's back to doing his very favorite activity, which is chasing away package delivery drivers. So I know it's working. I do want to make sure I mention that with all medications, there is a potential for side effects. So it's important that pet owners have a conversation with their veterinarian about what treatment option is best for their individual dog.
Great. Okay. You're a tribute to the animal world, and animals are part of us, and a big part, a gigantic part. In fact, I just heard that some places have storefronts with animals in it so people can go and pet them because they don't want to have them at home. Some people.
I would be at that store every day if that were near where I lived.
Is there a website we can go to?
Yes, thank you for asking. If pet owners that are tuning in would like to learn more, they can visit librela.com. I'll spell that Librela. They can get more information and see some success stories, because I want to make sure I mention that the number one goal in managing osteoarthritis, even though it's a chronically painful condition, there is therapy. We can make a difference. And that starts with controlling pain so that our dogs can continue to move around, keeping their muscles nice and developed, and keep them flexible so that they can do the things that they enjoy. So key takeaway is making sure that pet parents visit their veterinarian and speak to them about any possible signs of osteoarthritis they see.
I'm just laughing a little, and my wife will get upset with me. But in her list, number one is the cats. Number two is her phone. I'm number three, and we're trying to get. I'll never get up there. I know it. I see it. Great talking to you.
You
Thanks
can't
so
get
much.
can't get to the top of the list. Thank
Not
you,
when the
Paul. I
cats are there.
appreciate
I don't understand it, but okay. Take care.
it.
Thanks.
Thank you so much.